everyone. I hope everyone is doing well and enjoying the warmer temps, and good to see everyone's faces. I look forward to one day seeing everyone's faces in person. But thank you to our guests who are joining us here tonight. Welcome, Lindsay and Mike. And Lydia, we missed you last week, so we're glad to have you back. I'll go ahead and call the meeting to order. If you can go ahead and start with roll call, please, Heather.
Hey, everyone. I will start roll call. Lee.
Present.
Sabula.
Present.
Lyra.
Present.
Robinson.
Sean emailed me to let me know that he wouldn't be able to make it to tonight's meeting.
Perfect. Roberts.
Here.
Smith.
Present.
Hess. Ashley. Geyer.
Present.
Yang. Miyang.
I don't think we can hear you.
Oh, I see you.
Yeah, you hear me?
A little. Scott.
Present.
Christensen.
Present.
Council Representative Mayor Palmieri.
Yes, here.
Staff Representative Michelle Banky.
Here?
Assistant City Manager John Fitzpatrick.
Here.
Perfect.
I also see that Ashley Hess, I saw him a minute ago. He seems to be,
Ashley, are you on?
yes.
Present. Join.
We have a quorum.
All right. Thank you, Heather. We'll go ahead and start with looking at the minutes from our last meeting. Any points to discuss? Any questions? Any corrections that need to be rectified? All right, if there's nothing further to discuss, can I get a motion to approve the minutes from our January 25th meeting?
I move to approve the minutes of last month's meeting.
Thank you, Tim.
Second.
Thank you, me. Okay. All right. Can we get a motion to, or can we get, Heather, will you please take roll?
Absolutely. Sabula.
Aye.
Lyra. Roberts.
Aye.
Smith.
Yes.
Hess.
Aye.
Geyer.
Aye.
Yang.
Aye.
Scott.
Aye.
Is that 9 ayes, Heather?
Yes, I believe so.
All right, thank you. Okay, Well, moving along, we have with us tonight Lindsay Erickson from the Community Health Strategy, or from the Winnebago County Health Department, here to discuss and talk about the vaccine distribution and how we can think about equity, think about the vaccination from an equity lens. And Ms. Erickson, if you can go ahead and start, and then maybe we can, you have about 20 minutes if you want to. You can speak as long as you need, and maybe we can leave a few minutes though for questions at the end of your presentation.
Yeah, perfect.
Thank you.
Thank you so much. So this is going to be pretty low tech. I don't have any formal slides or anything. And really, I wanted to use this as an opportunity to hear from you and learn if you've been hearing anything about some potential barriers or challenges related to the vaccine. So, but my name is Lindsay Erickson. I'm here in my role as a community health strategist at the Winnebago County Health Department. So I've been working with a team on improving equitable vaccine access to those who may have barriers or concerns related to the vaccine. So we've been working to make sure that we have equity built into our process as we do outreach and education about the vaccine, and also working on some systems issues to actually get people access to the vaccine if they're eligible and if they want the vaccine. And so if we can reduce barriers to the vaccine, we know that we can help undo some of the disproportionate impacts that COVID-19 has had, particularly for people of color in our community, in preventing any widening of the racial health disparities that we have going forward. So I'll preface this and say this is all a work in progress, and we're trying to work to build relationships, facilitate trust in a system that has historically been not very trustworthy, especially for people of color in our community. So I'll walk through some of the work that we've been doing so far, but I really do want to hear from you all about what we might be missing or other barriers or concerns that you've been hearing related to the vaccine. So our first public vaccination clinic was out at Sunnyview Expo Center earlier this month, and that was open to folks who are still in that 1A, kind of that healthcare group, and people who are 65 and older. And you may have heard that our online sign up for appointments filled up within 40 minutes of it being released. But we did make the decision before that to hold back about 20% of appointments so that we could get people in who may not have access to internet or technology, and for anyone else with barriers or difficulties with access. So we're planning to keep that practice moving forward, to hold back a percentage of appointments so that we can get folks in who may be marginalized or have other barriers. So far we've been meeting with diverse community leaders and residents to learn what some of those barriers and challenges might be related to the vaccine. And what we're hearing so far is that there's really three big barriers: transportation to vaccination sites, language barriers, and trust. So I'll start with transportation. This is the first big one that we tackled. So our goal was that anyone with transportation needs would be able to get to a vaccination site without a cost burden. So we're excited to announce starting March 1st, next week already, there will be free transportation available to individuals in Winnebago, Outagamie, and Calumet counties. Anyone who needs transportation or help navigating transportation options to get to their COVID-19 vaccination appointment. So free transportation options and assistance that'll be available to folks, whether it's using fixed transit or fixed route, so like buses through Go Transit, Valley Transit, paratransit for people who qualify with disabilities or are over the age of 60, or using a shared ride service like a Uber, cab, Lyft, anything like that. So we're working with a few different funders: the Oshkosh Area Community Foundation, Oshkosh Area United Way, and then the Community Foundation of the Fox Valley and Fox Cities United Way. We're able to pull together funds to make this happen. And anyone in need of transportation will be able to work through their options, either utilizing their usual public transit or calling Make the Ride Happen to figure out what option works best for them. So we'll have more information coming out about that next week, but we're excited to make that happen. So free rides will be available starting March 1st and are expected to go through the end of the year. So the second piece is language. So making sure that we have translated materials in other languages that are commonly spoken in the county. We do have on-site interpretation at the public vaccination site that we operate out at Sunnyview through Language Line. And if we do end up doing, we're looking at doing some targeted vaccination sites down the line where we may have a larger population of folks who speak another language. So we're looking at having an interpreter on site physically to meet that need. We're also looking, there's a need for outreach and education in languages and ways that meet people where they're already getting their information. So whether that's looking at YouTube or radio or folks who text, how do we get information to where they're already accessing that? And the third piece that has come up has been trust. So this has come up in many different ways. And the big thing that has come up is mistrust in the process, given some historical issues that we've had, very real things that have happened to different groups of people in our community. And not feeling confident in the science or safety of the vaccine, given some of that historical trauma that has happened, especially to Black, Indigenous, and people of color in our country. So there are lots of questions around how the process works, and people have mentioned the importance of actually seeing it for themselves, seeing that process, seeing people they trust going through the process, and sharing those stories and examples of what it was like. So we're working on building up connections with trusted community partners, utilizing trusted messengers who have shared backgrounds and experiences with the people that we're trying to reach, and using culturally relevant information. So we know we have to work to earn this trust with individuals and communities, and directly addressing safety and other concerns that they might have with the vaccine. So we are looking at a few different possibilities of once eligibility for vaccine opens up and we have a better supply, more consistent supply of vaccine, looking at bringing vaccination sites to places where people already feel comfortable and familiar, whether that's something like different churches, community centers, just meeting people where they're already at and where they're comfortable. So I went through that pretty quick, but those are the work, that's the work that we've been doing so far, working to address some of the big systems issues like transportation first. That goes a long way to deal with some of the trust and the gaps that we have. But like I said before, we're kind of building this as we go. So if there's other concerns or barriers that you've been hearing or experiencing, I would love to hear them and bring them back to the team. And we're working on doing more outreach with different groups, trying to partner with different groups who may already have that trust with different community members. With our first rollout with the vaccination site at Sunnyview, it became very apparent that it's really difficult to reach people who may not already be connected. You know, that sounds pretty obvious, but how do we reach folks who are either isolated within their own neighborhoods, may not be connected to the ways that we give out information through our website and social media? So how do we address those barriers? How do we try to get information out and get people plugged in? If they are looking for a vaccine, how do we get that to them? So I'll open it up for questions or comments. If you've been hearing about any potential barriers or hesitancy about the vaccine or other ideas that you have, I'd love to hear it. So, thanks.
Can I go?
Sure, yeah.
All right. Thank you, Linz, for reaching out to us tonight. And also, I think maybe 2-3 weeks ago, you did actually reach out to me through an email to see if we could talk to the elderly in our community to come over and get their vaccines. What I found out 2 weeks ago, there were two problems, which I'm sure you've already addressed. One, the language barrier was part of it. But the second one, which was more complicated, was how to get into the system. Because what was provided to me, which I shared, was, I think, the phone number and for the county. So as they kept on calling, the feedback from the other end was go to the site and register. So I think 3 or 4 people could not get in. So I know they failed. And then sometime last week, they reached out to me again and find out if this has been fixed. So I still know we have some elderly people in the community who actually tried to get in, but that did not work out.
Yeah. Thank you for bringing that up. And I know that was an issue when we were first rolling out the appointments online, and we were getting so many phone calls that it crashed the county system, the phone system. So, but that's something that I'll bring back to the team too, to figure out. It can be very confusing when there's a phone system that is referring people back to the website, but we're telling people call this number. Yeah, so thank you for that. It's helpful.
Lindsay, I have a question.
Yeah.
Thank you for joining us tonight. So you mentioned that, within 40 minutes, all the appointments had filled up. So I'm guessing that there's going to be multiple rounds of this happening. So how are you informing the public each time when the vaccine does come? And how can we make that more equitable as well? Because the first come, first serve. I mean, I understand that that's how it needs, or that's what it's in place right now. But how are we reaching every single time the county does receive vaccines? Thank you.
Yeah, so we're hoping to have a bit more time. That first time we had about 3 days notice that the vaccine was coming out, or that we were receiving vaccine, and had to figure out how to get this clinic up and running. So we're hoping now that we've got it running, we know how this works, can be a smoother process. We'll have a few more days notice to be able to get this out. We do plan on still holding back a percentage of appointments for people who may not be able to access internet or technology, have other barriers, prioritizing other groups who may have had other challenges accessing the vaccine. So I think as the process goes along, there's always that initial kind of flood of people needing appointments. And as we kind of work through the different groups that are eligible, I'm hoping that we'll have more time to do kind of targeted outreach and make sure people have the information they need to get an appointment, and that it won't fill up within 40 minutes. So, but yeah, we're still planning on prioritizing appointments, making sure that we can get them to people who don't have the usual means to make an appointment.
So sorry, as a quick follow-up, do you have a waiting list then?
We don't, nope.
Okay.
So some counties have done a wait list. We have not done a wait list. So it's really been so far, and this is part of the issue, we've been relying on website and social media to get that information out, which causes a barrier for people who may not have that available to them. So I think we're working on trying to build up kind of, I see it as a network of different trusted community partners and leaders who can help us disseminate the information and get people plugged in to get appointments if they want them. So I kind of see it moving more towards kind of us being a hub that can take appointments and then share that out to different partners and residents so they can access it directly.
One of them is when you talk about holding back, say 20% for people who can't access through the internet.
how would a person access that? You know, specifically, what would a person do? Like question about 4 people who couldn't get in. Do they just show up there to register, or how does that work?
Nope. So they would call our COVID-19 hotline, and I should have this number memorized by now, but I don't.
236-3026.
Thank you.
Getting it out a lot.
That's good. Yeah. So anyone who does not have access to internet or technology can call that hotline number directly, and that's how, depending on the eligibility at that time, our staff would work with them to see if we can get an appointment made for them. And then, yeah, sorry, go ahead.
I'm sorry, I misspoke. That was 232-3026. 232-3026. And I'm sorry, did I talk over somebody? I think I was hearing a little echo.
That's okay. I was just going to ask my second. That's important you clarify the number. My second question is, are you planning on doing any target outreach in terms of like either going to the mosque or putting signs up there, or, you know, like the LGBTQ center at UW Oshkosh and putting something on their site? Are you planning on targeting some groups that are considered minority in our area in that way?
Yes, yeah. So that's what we're doing right now, to try to partner with those groups to figure out what information do the people that they serve, what information are they looking for, how do we get it to them in the most accessible way, where are they already accessing that information? So either utilizing their own websites or social media, or if it's at the mosque, providing that information in person if they attend. So yeah, so we're reaching out to partners to develop that information right now. And there's been some funding available through the state to do more of that work, specifically for organizations who provide some of that kind of direct service with different populations.
Thank you.
I have a couple of questions. Oh, go ahead, Mayor.
No, go ahead.
Are you serving all populations, including those who don't have a legal status? And if so, how are you reaching that population? Because I know they are they don't trust the system at all. And so how are you trying to reach that population? Because I know that they just don't want to be involved in this whole process because they don't trust, they're afraid.
Yeah, that's huge. So we have been hearing from folks. We met with some staff at St. Vincent de Paul in Appleton. They have staff who do outreach with that population. And then Casa Esther in Amro, and working with La Clinica in Washera County, especially for folks who serve either the migrant workers, farm workers out in that area too. So that's a partnership that we're working on. And a question that has come up a lot of, is there any kind of identification that's required when you make an appointment? Do you ask for health insurance information? So anyone who wants a vaccine and is eligible can get a vaccine. So we do not require a driver's license or health insurance to get your vaccine. The only information that is asked of a person is to fill out a consent form. So it's kind of basic information: name, gender, address, trying to think what else is on there, just basic demographic data. And that is used only to birth date. Yep, thank you.
So you're saying they don't ask for medical information or insurance information?
Correct, we will not. If someone accesses the vaccine through a primary care provider, they may, but if you go through a public vaccination site like Sunnyview, we do not ask for that information.
So like AMRO and all those other ones are not public? You know, the AMRO was providing vaccination.
Like AMRO Pharmacy?
Yeah, and then there was a bigger, that was not public.
They may. I'm not sure for each specific site if they're asking for that, but they're not able to, they should not be refusing anyone vaccine if they do not have insurance.
No, my point is that I think they're asking, and if anybody's going through there, that question alone would be a, oops, I'm
Mhm.
done. I'm turning around. You know, that was just an observation.
Yeah, it's intimidating not knowing what information is going to be asked and who it's shared with, and yeah, so that's really helpful. I'm going to write that down too, because we have to be explicit and say we do not require that information, and say who it's shared with. Yeah, thank you.
I have a couple of questions, if that's okay. Number one is, given that there may be a shelf life with some of the vaccines and you're holding back 20%, if you run into a situation where the 20% that you held back are not used, are you allowing kind of like a, you know, end of day or end of week, whatever that shelf life is, so that it doesn't go to waste opportunity for others to get that? And then the second thing I just want to share is I know that I ran into the owner of Olden Organics out of Ripon the other day, Tracy Vins, and she said that in April, some of the migrant workers are coming because she was doing inspections with the Mexican consulate for a house that they purchased for the migrant workers. So like, is there a way in which, because I think it's like 8 people or something like that. Is there a way in which, I don't know, they can set up like multiple appointments, or how would something like that work?
Yeah, good questions. So related to the shelf life, so when we have held back a percentage of appointments, those have, we've been able to fill up all of the appointments. So there are some cases where we may have a no-show for an appointment, or just have some, you know, once you open up a vial, you have to make sure you use all of it. So we do have a call down list of folks who may have called right after we filled up for appointments, or had to reschedule, and we'll call them kind of at the end of the day and see if they're able to come in and use up that dose. So we don't have any leftover dose. We haven't had any wasted doses. So, and I'm expecting that that'll continue. We'll be able to fill all of those appointments that we hold back. And for the migrant workers question, so we're looking at doing some kind of mobile vaccination clinics. That will likely be more possible once the Johnson & Johnson vaccine comes out. That's a 1-dose vaccine. So that'll be much easier to do a mobile vaccination clinic, so that we don't have to have people come back for that second dose. Just logistically, that'll be easier. So I think that's expected to come out either April or May. But yes, we're looking at doing some mobile vaccination clinics, bringing vaccination to sites where people already are. So that's in the works.
I don't have a question, but I have an observation. You guys did an awesome job. I didn't know you only had 3 days. And because I'm older than dirt, I was one that could go online, and we got our appointments, and the whole thing took maybe 30 minutes. They asked us to come only 10 minutes in advance. I have never seen anything so organized, so well done. They do not ask for insurance. They ask that you print off that form before. It was like clockwork. And then you sit for 15 minutes and don't have an adverse reaction. You can leave. We were the last appointment of the day. And what I noticed is once everything was done, they did say, if there are any caregivers who are here who are not scheduled, we have extra. And they were able to take care of everybody who was there. So that was really heartening to see that they didn't waste anything, and that there was no expectation that they would get it. There were not promises made, but individuals who were younger or who didn't have a reason to be there. But it was absolutely outstanding. I didn't know you only had 3 days, so kudos to you guys.
Thank you. Yeah, we have some really awesome staff who pulled this together and know what they're doing. So it's good to hear. Yeah, thanks.
Is there any geographic restrictions, or can anybody basically come in and sign up for the vaccine? So like, is it a county thing or city thing, or can somebody like come from anywhere in Wisconsin and sign up and come get that vaccine at Sunnyview?
So for our online signups this last go around, it was open to anyone who signed up. There was no restriction on geography. But for the appointment slots that we held back for folks who had barriers, we did prioritize people who lived in Winnebago County. And then from there, if we were needing to fill spots, we would look at expanding that, but we were able to only prioritize Winnebago County residents for those slots we held back.
Now, there's going to be another vaccination site open at the Culver Family Center at the university. Is that part of Winnebago County as well, or is that something totally different?
So that one, we have partnered with them, but that site is run by Aurora and UWO. So we have worked with them a bit on that, but the site that we operate is Sunnyview.
Thank you.
So far. Yeah.
And I can tell you on that process, so I actually got my first dose there Friday. But the way in which I had to get that, it's related to because I'm in and out of the clinics and the hospital every day, doing deliveries from the labs. But I went through the county's website because the company I work for is not Aurora. They're a subcontractor of Aurora. And so through the county's form that screened if you were eligible in the 1A for frontline or whatever, then they contacted my employer to confirm that. And then I eventually got an email with a registration code to go to the Culver Center for that. So, and I will tell you, just if anybody's curious, my arm was a little sore for a day, but that's all I had. And I mean, just like a little tiny tickle in my throat, and I have tons of allergies. So that's all I had so far.
I didn't have even a sore arm. It was as if I hadn't, and I have to say, I haven't gotten a vaccination since 1976. That was the last time I was ever vaccinated. I've never had flu. I've never had the flu. I've never had a vaccination. So I talk a lot to people saying I wasn't an anti-vaxxer. I just didn't. And so for someone like me who literally can tell you exactly when I last had one, to go in and do it this early is, I know it's been helpful to have those conversations with people, that they feel better talking to people who have had it, lived to tell about it, didn't have much reaction or any reaction, and talking about why we're doing it. So.
Yeah, I think that's really helpful to share those experiences and stories. And I think the more people know who've gotten it, it becomes a little more familiar, comfortable.
I think we have time for maybe one more question or comment.
And before we lose, thanks for coming, Lindsay. My name's Ashley Hesse. I see this. I find and it's exciting, especially to reach some of the hard to reach populations. And I wonder if this is under consideration, is allowing additional people that might not be primary medical care, but I mean, there are other professionals, including pharmacists, and others, a whole slew of recognized professionals could administer vaccines, in-home vaccinations, or people that really, in that regard, I know it could be a strategy. It's implemented elsewhere in the nation and possibly even Wisconsin. I don't know, but don't know if our use that option.
I think your first part cut out a little bit. So could you just repeat the first part maybe?
In-home vaccinations.
Did you say in-home vaccinations?
In-home. And yes.
Okay.
something to consider.
Yes, yeah. So that's also in the works for folks who may be, and correct me if I'm wrong, I was trying to catch some of the words, you were cutting out a little bit, but for folks who may be homebound or in need, may not be able to leave, looking at how can we get vaccination to them, either through any home care that they already receive, or bringing vaccine to them. And again, that might look like be more feasible once we have the Johnson & Johnson vaccine. Did that answer your question, hopefully? Okay, thanks.
Okay. Thank you so much, Lindsay, for joining us today. This information is extremely helpful in helping us understand how this is all rolling out, and it's apparent to me that while you say there's still work to be done, that there's been a lot of consideration for marginalized communities, and we're grateful and to hear that. And you can feel free to reach out to us as well in that effort. But thank you so much for joining us tonight.
Yeah,
we're appreciative.
Thank you, I appreciate it. And if you
All
think of anything else, feel free to contact me too, and I can share my email maybe with Michelle if you don't have it already. So
okay.
Thank you, everybody.
Thank you. Good night. All right. Moving on. The next item agenda is to discuss the designee for the Oshkosh Community Equity Ally Academy. Michelle, that was attached to our email. And I can just kind of read through what the purpose of that committee is, and then we can discuss a designee from our committee to join. So this is called the Integrated Comprehensive Systems for Equity, ICS, Community Equity Ally Academy. So this is through the Oshkosh Area School District, and the purpose is to learn about their equity efforts through this framework and process, and to develop a collective equity capacity. Another goal is to learn to support the Oshkosh area schools efforts in their process, and to apply the ICS equity framework in our own settings. And so this will be held over 4 Zoom sessions that build on each other. So that's kind of an overview of this academy. And yeah, so we can discuss if anyone is particularly interested in being our representative. We could discuss maybe what our role might be as part of this in our partnership with the school district. So I will open it up for questions or discussion.
This is Beth. I'm already signed up or planning on going to it. I don't have to go as the designee, but if no one else is interested, I could certainly make my role there be as the designee. But I'm already signed up. We're ready to go.
Thank you, Beth.
Thanks, Beth. Who's the target audience of this particular endeavor?
I can speak a little bit to it. I had a nice conversation with Kim Brown, their director of learning, as she invited representatives from the city to join this academy. And really, they want to involve all sorts of different members from the community. They have reached out to private companies, public companies, parents, nonprofit organizations, to basically hear what they have been doing and kind of learn this platform, so we can all have a similar conversation, we'll call it. So they have reached out to quite a few different entities within the city. I shouldn't say just the city, within the Oshkosh area. And when I talked to Kim about this committee, she was very interested in having us formally extend this committee an offer to send a designee as well, who can bring some of this back to the committee and share, with you. And also we can decide if there's anything from this framework that might help us drive this committee forward as well. So I thought it was a great opportunity, and Kim was very excited to have us invite you to this.
I'm totally fine with Beth representing us there unless someone else wants to do that, but I think I'm totally fine with Beth doing that.
Also, John Fitzpatrick and I will be representing the city in the first meeting, as it happens to be a council evening. City Manager Roloff was also invited but is unable to attend, as I'm assuming obviously our council members won't be available that evening as well.
Michelle, do you know if, I mean, I understand there would be a Zoom invite, but is it open to anyone who's interested, or do they specifically want one designee from our committee?
As far as I know, it wasn't open publicly. It was more inviting to as many entities as they could think of that could send a representative. I certainly believe they are open to having additional people attend, but it was not offered, I don't believe, as a public invitation, if that's what you're asking.
I would be interested in listening in on these conversations. I don't have to be the designee, but I'm definitely interested in hearing what the district, how the district plans to move forward in their efforts. With my education background, I'm intrigued. And I wonder, again, I don't have to be the designee, but I wonder if I could just, get an invite to that Zoom meeting and listen in.
I wouldn't think they would be adverse to, especially Beth is already going probably in her other role to, having a member or two. It doesn't have to be a designee per se, but they were very excited to extend an invitation.
Thank you.
Are we ready? Is it time to make a motion?
I would just mention too, if I could, as Michelle indicated, for the city here, we had myself and City Manager Roloff and Michelle invited, and I know City Manager Roloff can't attend that first meeting. And then Michelle and I were going to go to the first meeting ourselves and see if we both needed to attend, if City Manager Roloff needed to attend. So I'm just offering this up. I don't want to get in trouble with the school district, but obviously there's one slot open there for that first meeting, and then if Angie would like to attend, then we could just see how it goes from there and see what might be available. If you think that would be okay, Michelle, I know you spoke to Kim Brown personally, so just an idea.
Well, it seems like since Beth is already designated through another organization and they made the specific invite to the committee, if somebody wanted to make a motion, if Angie's open to being the designee, then we could lock that in.
I would like to make a motion for Angie to be the designee.
Okay, shall second the motion.
I will.
Can we take a vote?
Yes. Sabula,
Aye.
Lyra,
Aye.
Roberts,
Aye.
Smith,
Aye.
Hess, Geyer,
Aye.
Yang,
Aye.
Scott,
Aye.
Lee.
Aye. Thank you. Trust me.
This is
With
Beth
that-
again. I have a question about procedurally. Once someone makes a motion and it's seconded, aren't we supposed to open it up for discussion before voting?
Generally, yes, discussion would be appropriate at that time.
I don't have anything to say about it. I just wondered if, because I noticed we've done that before, will we go right into a vote and we don't offer an opportunity for discussion with some of our items?
And just to give a little, I think you can just, anybody can say, hey, point of order, can we have a discussion? You know, because sometimes when I'm running a meeting, I'll forget and I'll roll right through the motions and go on to the next thing. So just jump in there.
Thank you,
Right,
Beth, for
that's a great
reminding us.
point.
Great. Thank you. Okay, let's move this along. All right, back to our mission statement. Thank you to those who, I know this has been on our minds and a topic that we're continuing to just digest and think about. And so, Michelle, I don't know if you're able to pull up that Google Doc, and if not, I can read out some of the suggested mission statements.
I do have that open right now. I believe we can quickly make you the presenter if you do have it available, Angie.
I'm sorry, you can make me the presenter?
Yes, we can make you the presenter if you have it up right now.
Yep, I do. Can you just let me know if when you can see it?
Courtney, are you doing that behind the scenes?
I already gave her presenter access, so she just has to do the share button.
Oh, I just have to, okay, hold on.
So share content.
Thank you.
No.
Okay. Let's see. All right. I haven't done this, so let's see if it works. Okay. All right. Can you all see this?
Yes.
Yes. Okay, good. So at our last meeting, we were, we were at the point where we said the mission of the DEI committee is to inspire a civil, equitable, and conscious community. And Timber, Tim, and Mouche have added their ideas. Timber, will you please read your idea?
Yes. The mission of the Diversity, Equity, and Inclusion DEI Committee is to promote changes needed in Oshkosh to create a more welcoming, connected, and equitable city by consciously including voices who have been historically marginalized and excluded in its planning and function.
Thank you. Do we want to go through each one or maybe just read through all of them and then have a discussion? All right. So Tim, actually, will you read through yours, and then Mouche, you can read through yours, and then we can discuss how we want to proceed.
Yeah, this was kind of a Frankenstein project of various kind of mission statements I found throughout. Time scene. There we are. The DEI committee aims to foster a welcoming community for all. It is committed to promoting civil conduct, equitable service, and diversity in our community. It strives to create spaces where all individuals are treated fairly and respectfully. It is invested in ensuring that community services and resources are relevant and responsive to all, and that all can fully participate in community projects and decisions. It is committed to the continued and improved integration of equity into the fabric of our community in pursuit of equal, fair, and just outcomes for all.
Thank you. And then Mouche, will you read yours, please?
Yeah, sure. Anyway, I've just been reading through statements, and I thought like maybe I could throw in just a few lines in there. The first one was the DEI committee exists to build a better Oshkosh by ensuring integration of equity and inclusion in all city level decision making and amplify the voices of the marginalized in our community. The other thought again I had was the DEI committee exists to validate Oshkosh diversity by including the city's most marginalized voices in decision making and requiring equity across all governance structures.
Thank you, Mouche. I will open it up to others and hear what other people are thinking or questions.
So I like the content of actually all of them. I do. My only suggestion would be, and I do this because I had some experience in my agency going through this part and working through this, that the language has to be cautious. And what I mean by that is that words that can have implications will tend to shut people down. And so then they become completely disinterested. So I think we just need to be cautious about the language sometimes and some of the words that we use. But I like the meaning and the content of this. But that would just be my 2 cents. The wording should be cautious in terms of making sure that we're not turning people away, because some of those words can be judgmental or have a implication, and people will walk away because nobody wants to talk about this and nobody wants to face the fact that most of us have some kind of bias.
Mm-hmm.
Could I jump on?
Yes, please.
Yeah, not to disagree with my brother out there, but the point I'm trying to make is almost a little bit different from Hakeem, in a sense that the marginalized community itself, why are they marginalized? It's because they have not been listened to. That's the first thing that we have to understand. They have not been listened to. So to me, I feel like we shouldn't worry much about the language, because the fact that they have tried to be seen or to be heard, they've been disregarded. So I feel like whatever language we use, I think should be acceptable. It should be. I mean, that's how I see things.
I think too, I appreciate your viewpoints there. Maybe to Joaquin's point, you're right, it should be, but I wonder if the reality of the situation is that there are those folks that it might kind of turn off. I don't know. I get both of your points there.
Well, my problem is this. Okay, I may use like this word, the privilege, the white privilege, or fragility. So kind of like we are kind of like babying a little group. Like we are so scared. Like if you use this language, oh my God, they're gonna turn away from us. They are already turned away. I mean, there's no way I see it. Like we gotta hit it on. I'm sorry I see it this way. Like our job as a DI committee is to make the city validate. They have to validate by accepting like this exists. So if we can't get them to validate, I feel like we're not gonna go anywhere.
Joaquin, is there specific language that like you were kind of honing in on that you were thinking would be problematic?
Well, you know, I totally agree with what has been said. I mean, I don't want to obscure the reason why we're here. I don't want to do that. But I don't want to turn people off before we get to speak, because I've been in this community for 30 years and the progress has been slow. And to me, this opportunity with this committee, it's amazing that they opened the door to this degree. And so we have all these other agencies talking about all this stuff. But I'm just talking about my experience in my company. You know, I work in human services. And when we started to talk about this, people recoil at some of those words, and they're right away, the focus for them becomes, that's not me. Instead of saying, how can I open my mind? How can I look at things differently? It's a defense stance, and all of a sudden the conversation ends. So that's my only point, is that I think I would just caution, and I'll agree with anything that the committee goes in general, but I would just caution that, because you know, it's a new thing, and we all have biases, but we cannot all recognize them, and it is hard to do that. And so I don't want to stop the conversation before it even starts. That's my only point.
Yeah, Joaquin, I agree with you in the sense that we can't use language that creates divisions, or like this, us versus them. It has to be inclusive of everyone, and I think that's important to consider as far as our mission statement, that it is inclusive of everyone. So I think that's something we definitely need to consider and be mindful of as we move forward.
And, excuse me, Angie, I didn't get one in on time, but I do have one.
Yes, please.
So, I know it's easier for you to see it, but it's quite short. Would you like me to read it?
Yes, and actually, I could probably type it as you say it.
I'll read it very slowly, and then you can type.
Mm-hmm.
The DEI mission is to actively seek to understand the complex and rich identity.
Okay, you have to slow down, Carmen.
The DEI mission is to actively seek to understand the complex and rich identities of those living and working in Oshkosh, and to lean into the difficult topics with civility and grace. We aspire to be a place where individuals feel respected, accepted, and valued, because we know that we are greater when we are equal.
Carmen, can you scoot back to, we aspire to be a place for individuals to feel respected,
accepted, and valued, because we know that we are greater when we are equal.
Okay. Thank you, Carmen.
And if I may, I guess I'd like to go back to the purpose in the ordinance, just to reference, because I think that Timber, Tim, Mouche, and Carmen have all given us kind of elements of what's in the original purpose and intent of the ordinance for the group. And so the decision-making language, I feel like, needs to be like the reference to the advisory role of this committee in some fashion. And I feel like there are the rest of the elements that are in the council created ordinance are there amongst all of these. But the most, I guess, priority piece that I see that we have to ensure that is there is the, you know, informing and advising city manager and or council regarding the how part of getting this message out, whatever the final version of the mission is. If that makes sense.
To reiterate, Mayor Palmieri, you're saying that in our mission statement, we need to have a statement about how we'll get there.
No, not the specifics of the how, because that's going to end up in the action plan, right?
Mm-hmm.
But that the mission also reflects this advisory to the policymakers role. And I think that kind of gets at what Moshe is talking about, what Timber's talking about, what Carmen is talking about, of bringing those voices that have historically not been at the table, right? So I just, what I'm trying to say is, in any version that we come up with, that I think that needs to be spoken to or reflected.
I think that's really important because there's a difference between advising and doing. And I think that to highlight that this particular committee's mission is to advise that, and then again, get into all the other information that's part of all of these is really important.
Would folks feel comfortable looking at taking Timber's and then parts of Tim, Mouche, and Carmen's? Because I feel like Timber's really speaks to this, but then there are pieces of those others that might mesh in there as well.
Another question I have is, are we looking for a full, a lot of times a mission is a statement. And I think that there's a lot of, I agree with Joaquin and other things that have been said, that they all have really good information, but are we looking for, you know, a full description or a mission statement?
It's my understanding this was for mission statement. Is that?
Well,
Angie,
that's what I thought too. And so, you know, that, like, Tim has some really good information, but Timbers is already a statement. And so, you know, are we going to make it a really, really long run-on sentence as a statement, or just acknowledge that it's, we can't get into that level of detail with the mission statement, that it would be part of our action plan and other steps of the process to include the other information? Because if we're taking Timbers, which I really think would be great, and adding other parts of it, that's going to be one heck of a sentence. Versus, you know, if we took his and then incorporated the other components into part of the action planning and things like that, or maybe the vision.
So I guess what I'm hearing is that if we did with Lori, what we need to do is to say we're an advisory committee. At the beginning, we can say something like, in our advisory role, blah, 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 the mission is. Would that be sufficient, Lori?
Or at the beginning of Timber's statement, he says the mission of the DEI committee is to promote changes, but perhaps you could use language that says is to advise policymakers, and then Let's see here. I'm sorry. It's really small print and my eyes are kind of squinting. But the decision making, language that comes out of what Moshe, because I think this does talk about consciously including voices that have been, maybe left out instead of historically marginalized and excluded. I mean, if we keep the language simple, I think that kind of speaks to what you're saying too, Joaquin, and then also, I mean, because you don't want it to be too long to where somebody on the committee can't like memorize this and say that mission statement very easily.
Can I jump in? I think it was also my understanding that the mission statement is going to be short. And then later on, like I was looking at the City of Sheboygan statement, they have a longer piece that will go in now explaining more in details, like what Hakeem is talking about or what Timber's in detail now. But for the mission statement, if we can knock it out to like 2 sentences or 3 sentences with more important wording, I think that's what we need. Then later on, we can drop it down to make it a bigger piece. That's what I was understanding myself.
Yes, so you're right, Moshe. So we have typically what you would see is the mission statement, and then you would see the purpose, right? And so, we can make a very brief statement for the mission statement that encapsulates much of this more generally. And then the purpose, what you guys can do is advise the council on, changes to the wording that's in the ordinance for the purpose. If you disagree with that and you want to add or go into, other realms, because that purpose piece has already been like drafted in the ordinance. Does that make sense? But then you guys could wordsmith it from, like you're saying, more detail level here after following the mission statement. That's more brief. Yes.
So what if we started with timbers as a base? The mission of DEI is to advise policymakers of changes needed in Oshkosh to create a more welcoming, connected, and equitable city by consciously including voices in its planning and function.
Do you want to say all voices? Because they're already listening to voices.
Yes.
But they're excluding. Or that's the concept, so.
I like Lori's term too, voices that have been left out. It's descriptive and simple.
Oh, I think I misunderstood. I thought, okay. So just keep that. Okay, so including voices who have been historically marginalized and excluded in its planning and function.
Joaquin, how do you feel about that? Do you think that's too incendiary?
Or just maybe excluded versus marginalized, and excluded would be a little less.
That's exactly what I was going to say. Just get rid of historically marginalized and.
Like that.
Yeah.
So who have been excluded.
Yeah.
I don't want to interrupt the group's progress on this, but I'd just like to add a comment if I could. I think these are a lot of great ideas. And of course, I would never disagree with the mayor. I just want to get that out ahead of time. But I think what she was trying to also just illustrate is the council has already created the structure for this committee, and this committee isn't going to create a completely different structure for itself. So I don't believe it's necessary to duplicate things in the structure that the council has already identified. So I think, you know, when, and I don't want to speak for the mayor, but I think when she was talking about the advisory component, I think maybe she was just trying to reiterate what the responsibilities of this group were and some of the limits potentially. So if that's really the case, I don't know if it's necessary to duplicate that. Otherwise, you're going to need to say, advise policymakers who are traditionally the elected officials and the city manager. And then you're duplicating what's really in the structure of this. And I don't know if that was really the intent, to duplicate the structure that the council's already established. So with that long explanation, I guess what I'm saying is, I don't know if it's necessary to put in your mission that you're advising, because I think that's already described in the structure that the council has already come up with.
So what about the possibility of taking out policy makers and just to say advise of changes needed? Because I do think, again, there's a mission of more of action doing, and there's advising, which is very different. And it's, to me, kind of critical that we put in advise, but we don't have to put in specifically that it's the council and the city manager, and, you know, we don't have to list of all the people we're advising.
So you may
HR.
also be involved in providing advice to the community, you know, in your efforts in that way. So that might be a more generic way to include it,
Exactly.
but not exclude anybody.
Right. You know, it might be including the HR department. You know, it's just advising anybody who's affected. To me, that makes sense.
I agree with Beth. I think by highlighting some of these issues, we're actually advising the community of what's concerning, of what we need to change. So to cater it to one group, I think would be kind of narrow. So I agree with the changes.
And thank you, John. I think you said that very well. The redundancy doesn't necessarily need to be there. So thank you for that. If I could just offer one other thing. There was another place where someone, I think it was Carmen, said, I can't see down at the bottom. Angie, could you scroll up a little bit?
Sure. Yep.
The seeking, I love the word seek. The DEI committee, you know, seeks to facilitate, you know, persons feeling respected enough to contribute to, you know, something along those lines. Because I know, you know, we are trying to, as Mouché pointed out, not necessarily make this so watered down that it's not like meaningful, right? But also not wanting to inflame, but assert that everyone is respected in the decision-making process to equity and inclusion, you know, diversity, equity, and inclusion. So I'm kind of stuck around there, but I just wanted to give, I guess, some praise to the word to, you know, give respect for other voices, or however that ends up being worded.
I also just want to point out that that for the duration of this, our coming together to create this mission statement. I just want us to be mindful. I don't want to ever force anyone into contributing or, having to say something if they're not wanting to. But the majority of this conversation has been led by the same people in this committee. So just pointing that out there and being mindful that we want to make sure that everyone's thoughts and inputs are considered. And I often take the non-comments as agreements, but I also don't want to assume or I don't want to assume that either. At this point, do we want to table and continue this at our next meeting, or do we want to start with timbers and know that if we needed to make changes later as we evolve or as our committee as our committee evolves, that we can go back and revisit this?
I like timbers. We're gonna have to change some of the wording because it's not is to advise of changes. It just doesn't flow. So I think we just need to tweak, but I like the basics of it.
As a non-member, I would just add too, I think you have some really well-written missions here, or some really good things. One thing I would add though is, Carmen's is really beautifully written in a manner where it almost invites others to participate in the way that it's worded. And I think that's a real valuable component. If you can think of a way to incorporate some of the language that she's constructed, with the rest of the other ideas, I think that, that concept is really important, I think, to
Thank you, John. That's why it took so long to do it, because words are, so thank you. I really appreciate that comment.
You're welcome.
And that doesn't mean that these words all these words can go into action statements and they can go into other places, because the mission statement, by the very nature of a mission statement, is brief and to the point. That's not necessarily where it ends.
So I think, this is just my opinion, I think we've made some really good progress tonight, and I wonder if we do continue this conversation at our next meeting, having one extra meeting under our belt and having this discussion, if we can, maybe come closer to that mission statement at our next meeting. I want to be conscious of our time, and we do have one other agenda, or two other agenda items. Are we okay with tabling and continuing this conversation at our next meeting?
Is it possible for us?
Oh, go ahead.
Is it possible for us to table at this point? And if we go through the other items fairly expeditiously, we can come back to this. I don't know about everybody else, but I really want to finish this mission statement. If we cannot revisit it, it'd be awesome. Just because I feel like we've got a lot of other stuff that we want to start doing, and I don't think it doesn't seem like anybody's in great disagreement where we're saying no, absolutely not. We're just tweaking. And
right.
If we can go ahead and tweak away this meeting, and then next meeting this is off the agenda, that's kind of cool, right? But I do want to move on. I'm not suggesting we don't move on. I'm just saying if we can move on and expeditiously go through the next thing, can we come back to this if there's still time?
That sounds like a good idea.
I agree with Timber. I think that we working on this mission statement for a while already, and I think it's important that we get it done, finalized, and actually launch this committee into actions. I think we should do that. If we have to take a little bit more time tonight, I don't disagree with that. I don't know how everybody feels, but I think that we need to finish this.
Okay.
I like what Timber has here. I like what you guys have revised here. If we could just maybe add a few more words coming from the other people's parts and put it in here, I think we had a very strong, great mission statement already.
Okay, how about we will table this for now. We'll move on to the next agenda item, or next agenda items, and then come back to this if we feel we're in a space to do that.
I just kind of had a little. The mission of the is to act in an advisory role to affect the changes needed. To affect. Yeah, thank you.
Mm-hmm.
And I would even go and say at the part in which welcoming, connected, and equitable city by consciously including marginalized voices in its planning and function, and we can take out the part where it says who have been excluded, because maybe that feels a little
What about removing to, because really can't you say the DEI is to act in an advisory role to create a more welcoming, like is that middle part there really necessary?
I definitely think we could restructure the beginning so it's not so wordy. It is a little wordy, right?
I agree with what was just said, to take that part out.
What was that, Tim? So is to create.
You could take out act in an advisory role to affect the changes needed in Oshkosh. And you could put Oshkosh in where you say city.
I still think we should keep advisory in, like, is to advise.
Yeah, sorry, yeah, you're right. I didn't mean to take out that advisory piece. Sorry.
Yeah, you had that in there, and that was good.
Just for abbreviating slightly, I think we could remove the mission of and just say the Diversity, Equity, and Inclusion Committee seeks to advise. advise or facilitate the creation of a more welcoming.
Excuse me here a little bit. I'm having a struggle here with a little bit of that wording of the seeking itself. Are we just not supposed to advise the city, or do we have to like seek, like we have to like have a permission to advise them? I feel like we just have to advise them on what we see we need.
Yes.
The trouble for me is just that wording itself, the seeking itself there. I'm sorry if I'm being radical here, but my understanding is just I'm losing it. It's kind of like action, you know?
I agree. Are we seeking to advise or are we advising?
Yes, that's the question maybe that I need to be explained. What are we doing?
The DEI committee is an advisory body that aims to create a more welcoming connection.
Or what about the DA will provide advice regarding the creation, blah, 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 blah.
Could we say the purpose of the diversity committee is to advise, blah, 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 blah?
To advise the city.
Yes.
So the DEI committee advises the city to create a more welcoming, yes.
You guys, I want to apologize because I think that one of the things that a facilitator might be helpful to us would be separating out vision statement, mission statement. So if you have a vision statement, it's more of a future state that you want to see. And then the mission piece is kind of the how we get there. And so I'm just gonna I think apologize for like confusing things earlier. And so I'm wondering if we were to go into that other agenda item discussion about potential subcommittees with relation to seeking a facilitator to help us move into the plan, if that might reshape what our thoughts are on this, and maybe that's why we're getting up a little bit.
I would, just to add a little to the group too, I think that might help. But also, I think there's another way to incorporate advice into this process too. You know, when your full plan is developed, you know, that can be a component if you wish, but your mission is to create a more welcoming, connected, and equitable Oshkosh, right? Your mission isn't necessarily just to advise, you know, it's a vehicle by which it's created, but you know, your mission is really to help us create that better community. And I really believe that, you know, we can incorporate the idea that you're limited to advice to a certain degree, and some of your actions are limited. But I don't know if we need to incorporate that in the mission, I guess, is what I'm suggesting you consider. So you're in Timbers, where the cursor is right now, you know, if you took that component out, it might be a little less awkward. You could just say the Diversity, Equity, Inclusion Committee. The mission is to create a more welcoming, connected, and equitable Oshkosh by consciously including marginalized voices in its planning and function.
Yeah, I agree that that the using or that first part is a little awkward. If we did add back the mission of is.
And if you take out the advises the city, it's already implicit in the consciously including marginalized voices in its planning and function. Advisory is kind of already in that. I interpret that anyway. So maybe that word advisory doesn't even need to be there. And I know I'm kind of coming full circle on that.
Sorry again. I'm just getting confused here tonight. I thought our job is to advise the city on how to make the city welcoming and inclusive. That's what I think. But for now, I'm feeling as if it's our job. I don't know who's doing what. You know, it's the city that's we're supposed to advise them on how we see fit, how we want things to go. And then they do their job. That's what I'm thinking. Because my fear here is I feel like things are going to be watered more and more. I'm actually lost here, really. I'm lost in what's going on.
I do think this would be a good time to table this, move on to the other items, and as that may give us some clarity as to where we go next. But I think we have a lot of really good stuff here, some of which will end up in vision statements or other places.
I agree, and I think that even having these conversations and bringing our diverse voices is part of the process of we are doing what you know, we are fulfilling our duties. We're consciously thinking about and creating the space, and so I agree. I think maybe we can table it for now and come back to it, whether it's tonight or the next meeting. So anyone would like to make a motion to table this? They are welcome to, or you can, anyone's welcome to add more input.
I'll make the motion. Can we table it? I make the motion to table it, whether later on in the same meeting or to the next meeting, preferably this meeting, to move on to the next agenda item.
I'll second that.
Okay. All in favor? Do we need to take a vote, Heather, or can we, or is there any thing to discuss or questions? Okay. Do we need to take a vote, Heather, or?
Yes.
Okay.
Sabula,
Aye.
Lyra,
Aye.
Roberts,
Aye.
Smith,
Aye.
Hess,
Aye.
Geyer,
Aye.
Yang,
Aye.
Scott,
I
Lee.
Aye.
Perfect.
Michelle, can you go back to our shared or our screen where we can see each other's faces?
Courtney, can you unshare her screen?
Oh, is that me? Okay.
So I don't know if, Courtney, can you take away her ability to share? Okay, there
I
we go.
got it. I got it.
It wouldn't let me.
Okay. All right. Okay. So the next agenda item is to discuss subcommittees. And Michelle, will you please remind us of just the procedure, or not the procedures, but as far as the subcommittees, just reminding us that these subcommittees are subject to the same open meeting laws, and any other information you'd like to share regarding subcommittees?
Sure. So obviously there's some interest in creating a subcommittee or multiple subcommittees, and all subcommittees are held to the same standards. We would have to notice them, we have to do minutes, and follow the same rules of order that we would in our normal meetings. So if we do have an official subcommittee, obviously of multiple members of this committee, we would follow the same protocols. Obviously, we would help with the putting out the meeting notices, taking minutes and all of that as well, to make sure, of course, that we're following the proper protocols of the open meetings laws.
I have a question. Do they have to be members of this committee, or can they have meeting from the public to be part of that subcommittee?
A subcommittee could have a meeting with public comment if that's what you're asking. If you wanted to involve others from the community, I don't know, Jen's.
Yeah, I might be able to help with this. Yes, you can include people from the public. Those people have to be approved by this group. An example I can give you is when I've done some recruitments for our police and fire chief. We had a variety of different committees that participated in that process. One was a citizen committee, one was a peer committee of other fire chiefs and technical experts. One was a police and fire commission. So you can have subcommittees, but it's my understanding that those people that participate as members of those subcommittees have to be approved. So it's a little procedural, but it can be done.
Thank you.
So the main reason we had this on the agenda is because moving forward, one idea is to create or put at least a request for proposals for a facilitator to lead the creation of a plan for this group. And, you know, we thought instead of the entire group taking this on, perhaps a subcommittee would be more efficient. And I think that in general, as we move forward, we can possibly have more progress if we are divided into subcommittees based on interest, talent, passions, whatnot. But one area that we do want to move forward with is to hire a facilitator to write this plan, an action plan for this group, which might include refining the mission statement and our vision and the next steps. Another possible subcommittee that I was thinking, and kudos to Joaquin and Mouche and Mi Yang for the article in the Herald. I think communicating with the public is extremely important. So perhaps another committee could be a communications committee, and under that could be just even thinking back to Lindsay's presentation, possibly that communication committee could be mostly in charge of ensuring that language is considered in our communications and in whatever, not just for our committee, but in other city domains. But I'll start there as far as why this item is on our agenda. So I'd like to hear thoughts on if anyone is interested in leading this subcommittee, or if, yeah, so I'll stop there and leave it up to questions and comments.
So Angie, do you have the idea of what all of these subcommittees would be outside of communication? So there would be a communication, and what other subcommittees in specific were you particularly thinking? Or are you leaving that up to the group to come up with what they think they need as subcommittees? And I'm just curious.
Yeah, so the agenda item was put because of the idea of creating a subcommittee specifically for hiring a facilitator, but it's also open to other committees, subcommittees that this group sees as necessary or fit in moving forward with our mission and with our duties. So it's open for discussion and for what other areas that people may see as needed.
So just a question then, Angie, if there was a subcommittee that was, let's say 3 people and made the recommendation, they did an ad hoc committee that's, just a month or a few weeks or something along those lines to bring, is the idea they would bring back recommendation after vetting some possible providers of that facilitation for creating the action plan? Is that what you're thinking?
Correct. I think it would, as far as the structure of our meetings, I think having subcommittees would also be more efficient in getting more tasks complete. And we'd still have room for these, for whole group discussions, but as far as the actual tasks themselves, the hope would be that having a smaller group and maybe even more pinpointed as to someone's or people's passions and interests might help move and progress some of the goals that we have for this group.
Is it important? Oh, sorry.
I was just saying one other possibility for a subcommittee would be, and maybe this is something the whole group does, but would be to look at how we or come up with some of the ideas on how we solicit input from others. We talked about a survey, so maybe a subcommittee could be the one helping to develop the survey that goes out, or just kind of giving some guidance on how we want to make sure that we are including input from others with everything we do.
Yes, thank you, Beth. I agree that, and maybe that could go under communication, or yeah.
Do these subcommittees need to also be recorded for the city to make available to the public, or not?
It's not required to record meetings, but it has to be available to the public as, again, under the open meetings laws. So we are not required to record meetings.
But so we would post when it comes and how they can come and view. Is that what you're saying?
Correct. The
Okay.
public could come in and watch your meeting if they so chose.
Thank you.
You did say they had to be taking minutes of those meetings, right?
Yes, we would have to take minutes and we would have to post those minutes just like we do these
Okay.
to make sure that they're compliant.
They're recorded, just not electronically,
Right. Not every word.
but there's a record of the meeting. Yeah. Okay.
Just another idea for your consideration. You know, I think the subcommittees are a great idea, but you could always create the plan, have the different components of the plan, and then establish subcommittees to work on those different components too, rather than create the subcommittees ahead of time before the plan is established. So it's just another way to do it. Just an idea for you to consider.
Thank you, John. Yeah, I think that's a great point, and I think it might be sometimes creating the bigger plan and finding subcommittees, but I think for this situation and moving forward and hiring a facilitator, I think that there's a more immediate need.
And I can offer another option for the group to consider too. Certainly the group can establish a subcommittee and select whoever they wish. And, you know, we have some money budgeted in our human resources budget to help facilitate that. But another thing that you may want to consider is, you know, we've already engaged a consultant after we've done research associated with the marketplace. And, you know, we certainly could inquire with that group too as to whether or not they would be willing to help facilitate, just as an option for you. We already have a contract in place. We could do an amendment to that contract. And I know that ultimately this group is going to be meeting back with the city proper to talk about, you know, what's been done and approve the measurements. That's part of the responsibility of the group. So maybe some familiarity with what's taking place inside the city would also help this group. But it certainly is up to this group. It's just an idea and it's just an offer for you to consider, and it might expedite the process and provide different connectivity, but it's not your only option. I just wanted to throw that out there.
John, can we just clarify, because it's my understanding from Mr. Roloff that the company that was selected, REI, that Terry Howard took another position. And so she was delegating off this contract to somebody else. So is that realistic that that firm is available to this group, number one? And number two, at what point would this group be receiving those equity measures from the departments that they can even start working with that?
Yeah, it's FEI, and the mayor's right. One of the persons that was working with is taking a job as a diversity, equity, and inclusion coordinator at a university. But she also had, it wasn't just her. There were 3 people that were part of that process. And I know Michelle is meeting with them on a regular basis. And Michelle, you know, maybe you could just tell them a little bit about that group.
Sure. Well, there were multiple people, of course, and I mostly am interacting with Raquel, who was a partner with Terry during all of this. But FEI in its own right has quite a bit of experience with diversity, equity, and inclusion, and a lot of training in those areas. So there are still multiple people within the organization that are very versed in DEI, and of course we continue to work with them. But mostly I've been working with a lady named Raquel and Ralph, who both do training as well as DEI analysis. And they've been assisting us with our survey and will be assisting us with our next steps of our DEI journey with the city.
So one of the advantages of utilizing them would be the fact that they're already familiar with the city of Oshkosh, and so therefore the learning curve would be very short, so to say. Is that what I'm hearing?
I think it might be helpful, and I don't want to make it a commercial for FEI, but you know, we looked at them quite extensively. They're owned by the Alliance. Oh geez, it's escaping me now. The Alliance.
The GARE Alliance,
Yeah.
Government Alliance for Race Equity.
No, it's
No?
the Alliance for Strong Families and Communities. So they have a social network that they've operated in a municipal kind of context where they interact with a lot of social program agencies to help facilitate some of the things that we've talked about earlier. You know, when we were discussing some of the barriers to immunizations and things like that. So I think, you know, there are a lot of unique facets to their group. They've got a lot of experience, and they've kind of dabbled in a whole variety of work areas that are tangential to diversity, equity, and inclusion too. So it's just an option.
So if I could go back to what the agenda item that we're talking about with the creation of the subcommittees, can I just ask, is this group interested in having, rather than a permanent subcommittee, an ad hoc, you know, for let's say 30 to 45 days to report back to this group on what the options are for facilitation of doing the plan? You know, just to kind of boil down into an actual, you know, do you want a committee? Do you ad hoc group to say, yes, we're going to work on this and make a recommendation to the bigger group in 30 days?
I would be in favor of that, of going, and then that sounds more in line with maybe even the purpose of bringing this up, was not so much for a permanent subcommittee, but more of the task of finding a facilitator. I was under the impression that there had to be a subcommittee to move forward with that task, but I think you're saying, Mayor Palmieri, that we could create a ad hoc committee that then is not bound to all the same rules and open meeting laws, correct?
Well,
or can you clarify
yeah,
that?
I don't want to say that. I think they still have the same rules. It's just that they may not be a permanent fixture. A specific task with coming up. So for example, we had an ad hoc that worked on a special assessments question and making recommendation to, you know, the long range finance and council, etc. So that's just maybe one other shape that it could take that doesn't commit to and later dissolution. just another way of doing it. And maybe John, you have or Michelle, you have a different perspective on that.
Right. Well, if we obviously are going to have anything near a quorum, it has to be an official subcommittee. You know, I did talk to legal a little bit. You know, certainly a member could coordinate with members of the city and not be a subcommittee to look for options for a facilitator. But if we are going to have a formal meeting and decision-making process, I think it definitely has to be a subcommittee. But if you're just looking to gather some information and present to the larger committee without, again, having too big of a, we'll say, subcommittee, there might be some options that we wouldn't have to form an official subcommittee. But again, generally you have to be careful because you can't end up with walking quorums. So if you're going to have more than a couple people working on a project, I think legal would recommend we officially do, even if it's a temporary subcommittee, a subcommittee.
Does the city have expectations as to how choosing a facilitator or coming up with ideas for a facilitator are vetted out? Or can we just, as a committee, say, let's go with who the city already hired? I mean, what are the city's expectations of vetting this out?
Well, we went through a formal request for proposal process and put it out to entities that, you know, and we do have specific expectations of insurability and all those types of things when we select the vendor. So we went through a pretty formal process. I don't know that this has to be as formal. Obviously, it would be still a contract with the city. So our purchasing department, I believe, would have to make sure we have certain expectations met in order to create a contract with a facilitator.
But I mean, do we have to send out an RFP to several different facilitators, or can we just, you know, pick one and say, please pursue?
I don't think we need to send out a formal RFP like we did with our request. I mean, we didn't need to do that either. We just thought it would be a good idea to provide a variety of people the opportunity to seek to work with us. So we did that anyway, even though we weren't required to. But in this case, you know, what I understand the scope of the committee and what you're looking for, I don't think it would be required to do a formal RFP.
So knowing all
And
this.
as far as the city's expectations, you know, it's really up to the group in terms of, you know, whether or not you want to develop this plan yourself or whether or not you think it would be beneficial to have a facilitator assist you with that. So it's totally up to the committee.
So at this point, is there anyone, or are there people who are like, yes, I want to do this, that are wanting to step into this role?
Of course, I'm happy to help. I know I'm not on the committee, but I'm happy to help.
Thank you, Michelle.
In just facilitator that is already contracted with, if it would be easy enough to amend that contract based on what John said, it somehow was to the information and the decisions that are going on in other city departments. I mean, we need that information. We need to be told, man, this asking how is this, and this is the closest gotten to getting to that point. So there's been and discussion there must be that I don't know what the city's doing. We have we can advise in all different directions, but unless it's in alignment with where things are going, it's kind of just a lot of wasted time. I would suggest that we work with who the city's already working with. That person is already sense of their and city agencies, if you will, and like I want to understand what's being done, what's going. Is this in what needs done? I don't know. Thoughts, I guess, out of my head, but just suggest it's simple. Let's work with who the city's already working with and start there.
And that's
you
where
said.
I was headed, is rather than spend another 45, the subgroup determine who might be the facilitator, can go with the facilitator that the city already has so we can move forward with our plan.
And it sounds should go from there. That's where I'm at. So yeah. So I mean, oh, I would have we work with the city's current facilitator. Ask that they, amend the contract in order here in developing an action plan.
I'll second that motion.
I just want to be very clear. Ashley, you were cutting out a little bit. So did you make a formal motion? I just want to make this very clear for everybody.
Yeah, yes, correct.
So you made a formal motion for our group to use the facilitator that the city has already committed to in
Contract.
moving forward with our plan. Yes, okay. And Joaquin, you second that motion. Okay.
Correct.
We'll open this up for questions and discussion and then take a vote. Thoughts? The only comment that I want to add is that, as part of, we talked about it as part of our mission statement in including all voices. And I just wonder if in that decision of hiring FEI, if there were diverse voices represented in that decision-making process, just so we ourselves are carrying out our own mission statement, if that makes sense. That's the only reflective thought I'd like to add to that. Whether that decision-making body was a diverse or did include voices from marginalized communities or anyone from this committee. So yeah.
But is the purpose of the
And get where you're.
I was going to say, is the purpose of the facilitator though to basically share our whatever our plans are, or whatever we come to conclude, or our results or report out. So they're really an extension of us, right? If I'm understanding what a facilitator is. So therefore, we are those diverse voices, and they're just reporting out on behalf, and then helping us guide through maybe how to properly put those things together. I just want to make sure I understand that, because that helps make the decision.
I think they just help us organize the direction that we're going based on our thoughts and our input. So ultimately, we can say, no, we don't want to go in that direction. And that's it. So it's not like we are cemented to that situation. So I just think that based on our brief history, it'll be nice to have someone that can help us organize a little more and maybe have a direction and go accelerate the pace of what we're doing.
Do we want to include a few of us, or one of us, two of us, to partake also in that, or just be that, maybe that communicator or the liaison process?
Well, hold on a second, Angie. If I understand this, the motion that's on the table is to use the facilitator with that the city has already contracted, but to request an extension of the contract to work with this group, the plan. Does that help anything?
Thank you for yes, that clarifies. Okay.
So
Okay.
certainly, if I could just jump in, we could ask FEI if they'd be willing to do that. And as I said, we could amend the contract to facilitate that. We've already got the money to expend. We could have them come and talk to the group, and you could ask them any questions you wish. You don't have to make the decision tonight if you'd like to do more. Just as you've had speakers the last 2 times, we could have them be a speaker this next time, and you could ask them anything you wanted, talk about their experience. We know a little bit about it. They've worked with, Michelle, help me. They work with the state of Minnesota, the state of Wisconsin, the city of Madison. I'm sorry, Dane County in Wisconsin. They've got an extensive process and experience and staff. And as I mentioned, their ownership really lends itself to community-based initiatives, which I think really is the focus of this committee. So I think it would be helpful, but you need to be comfortable with it. It's just an option and an idea. I certainly wouldn't want anybody to think we're pushing anybody on you at all. But there is some familiarity, as Ashley said. It might help facilitate, understanding and awareness. They could say, hey, we're working on this right now with the city. Here's some things that you may want to consider. It might be helpful in that regard. So.
And just in full transparency then, John, it was my understanding that as of last month, they had not started yet. So they may have a little bit of history. They're just very, very starting to work with the city, correct?
Yeah, we've been working with them actually since last fall. Part of our process really that we've talked to them about, and this doesn't need to be the same process for the committee, is, some basic information gathering, which they've completed. And then after that, just kind of a debrief in terms of the information that they've assembled for us. That's what they're doing internally. And then after that, the idea would be to use that information to establish the opportunity to have some planning sessions and then construct a plan. And then after that, have the plan developed and have some measures developed. I mean, that's a very basic outline. So I've condensed a lot down. And I think a similar process could work, with your committee. But of course, you can modify that outline however you see fit to include, other elements of public outreach. And and then, of course, as the charge of the committee is to approve the measures that the departments establish. So we didn't think that it would be good for us to go forward with any of those things until we assessed where we're at, provided the opportunity for some education and training. I forgot about that component. So there was some common understanding. And then, have that plan and the measures developed. So that's really what they're doing for us. Am I missing anything, Michelle?
No, like you said, they're helping us assess so we can develop our plan. They have extensive experience in employee training, which is part of our expected program.
Hold 1 second. So you guys are providing a lot of information and that I think that's helpful, but there's a motion on the table. And the group can either vote on that motion, or if you decide that you want to withdraw the motion and invite them for an interview, you could withdraw your motion. So just a point of procedure here, that's all.
Thank you.
So yeah, that would definitely be an option. We'd be happy to invite them.
Well, look, it's going to make everybody more comfortable in the group. I am happy to draw the motion. I just feel we need to get something done, and this is the most logical approach to make a connection. Also, on current tracks at our chart, if not specific of what in this act, So if it's comfortable, get this group, have a representative here. I am happy to withdraw the motion for the time being. But let's
I'd like to move forward with the motion and still invite them.
I agree.
I'm with Timber. I'm with Timber.
Because there is a motion to take a vote to move forward in working with the city, invite them to our next meeting, get more information.
Well, the motion is to go with this group. The inviting them will be after the fact, but the motion is to go ahead and, you know, connect with this group and use them to facilitate our direction.
Thank you. Yes. Are we ready to vote?
Yes.
Heather?
Sabula,
Aye.
Lyra,
Aye.
Roberts,
Aye.
Smith,
Aye.
Hess,
Aye.
Geyer,
Aye.
Yang,
Aye.
Scott,
Aye.
Lee.
Aye.
Perfect.
Thank you, Heather.
You're welcome.
Okay. Let's move on to our future agenda items. So currently we have the item of inviting the facility or inviting someone from FEI to come and speak with our group.
I will try to arrange that for our next meeting.
Thank you, Michelle. Other agenda items anyone would like to add?
Things has been circling around, and it had to do with a topic that was brought up around the Chief Oshkosh statue and where is that? What's going on? I mean, that's a potential discussion area, I thought, that we could bring up. The other one that has been on my mind is the new lawyer and the say county judge. It seems to be kind of somebody that exciting. I would love to get inputs and take on policing, community relations from a perspective of a judge. Does DEI kind of concept, you know, it's kind of a fake thought, but it seems to be a worthwhile discussion there. I don't but just things for those are the thoughts that are in my mind. I don't know.
I didn't catch what Ashley said. I'm sorry. Something about a judge.
The new judge appointed by Governor Evers, the first African American judge appointed for this county. Ashley is suggesting that we invite her to as a guest and talk about issues around policing. Ashley, please interrupt if I'm not clarifying this in the way that you meant.
From the perspective of a judge, you know, and equity, include police, you know, disparities and incarceration rates. That's a whole this in for us again to have a perspective of do we have city, just all things around incarceration, you know, and equity, diversity, you know, issues pertain that we have something to advise the county on, but necessarily it seems something that could help educate from us. That was to us. We don't said 10. Other I'm sorry.
And I think Ashley, because your connection's kind of choppy, I think the first item you brought up was whether or not DEI wanted to invite maybe Dr. Manning, Dr. Pascal Manning, who brought forth, worked with the Landmarks Commission and some other folks about the Chief Oshkosh Monument. Is that what I understood?
Yes, that was yes, correct.
Thank you, Ashley, for those suggestions.
One other possibility, either for next month or I guess April at the latest, would be June is Gay Pride Month, and are we going to do anything in regards to that?
I'll share that I would usually do like a proclamation. But certainly, you know, we haven't really like got into discussion about folks that are from the LGBTQ community. Is there somebody that you wanted to have discuss about that, or what were you thinking?
There are different communities who've done different events or parades or, you know, beyond a proclamation. I think because the UW Oshkosh has that LGBTQ center, they might be able to speak to what ideas we could have. You know, again, if our ultimate goal is to create a more welcoming committee, how can we welcome people who are gay without I don't know, just I guess they would be able to provide ideas, but there's other municipalities who've done things to be more welcoming of that community. I guess that's why I wanted on the agenda, is to talk about what, if anything, we could do.
Yeah, Moshe, would Alicia Johnson, do you think, be somebody that could come and speak to that?
I think I could. So can you hear me? Yes, I think I'll try to ask Alicia Johnson tonight, and I'm thinking she should be able to come in and talk.
And then there's also the Diverse and Resilient group out of Appleton that serves, I think, Northeast Wisconsin. You know, I don't know what their availability is, but that's the former DEI person from Appleton, who's the executive director, Kathy Flores. So it could be the case that or at some point having a presentation by Diverse and Resilient from the LGBT, because they do a lot of things, I think, with folks on the at risk for homelessness and things like that, right?
That is correct.
Are your thoughts, I mean, we've got quite a few of possible invitees. Any thoughts on, you know, this might be a lot for one meeting. Any priorities or what we would want for this next month versus maybe April? And I can certainly work with Angie and Ashley as I do to put together the agenda on those as well.
Okay. Any other agenda items that, and please, you're welcome to always submit agenda items via email to me or to Michelle or Ashley. But I'd like to move on. We're at a point where we can circle back to the mission statement, or we can table it for the next meeting. Thoughts? I know there are both requests to complete and finalize it tonight, but also I want to be conscious of our time and understanding that we've gone over 2 hours, and I want to be mindful of everyone's schedules as well.
I'll make a motion to table it to the next meeting, but I really want us to finish it. It can't jump another meeting. You know, I mean, you know what? If we have 2 sentences that take up 4 meetings, that's crazy. We can do better. So we you know, let's table it for now because this has been a super long meeting. But for the most part, I mean, we got to get it done the next meeting. Gotta.
Amber, would you like to make a motion to table?
Motion made.
Anybody second?
I second the motion.
All right. Okay. All in favor of tabling the next meeting? Aye.
Aye.
Hey,
Okay.
but you guys made a lot of progress tonight in, you know, moving forward on the discussion facilitation, and we skipped the whole having to create a subcommittee or ad hoc or any of that. So, thank you,
And
John.
maybe the facilitator can help with the, you know, with the mission statement, the construction of the plan, the language. So I think you guys are doing good. Don't get down on yourself.
Thank you for that encouragement. And with that, I'd like to say good night, everyone. Thank you for your time, and please feel free to add to that Google Doc if you'd like, and reach out to
You need
anyone else.
Adjourn.
Motion
I'll make a motion to adjourn. Someone like to second that?
Second.
Thank you. All in favor of adjourning?
Aye.
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 Good night, everybody.
Good
Have a
night.
good night. Bye.